Health and Human Services Secretary Robert F. Kennedy Jr. has launched an FDA review of Mifepristone. It's a drug used in 2/3 of abortions in America. Abortion rights activists say they're worried the review could lead to a ban, even in states where medicine abortions are legal. Let's bring in Dr. Jessica Shepard. She's the chief medical officer for HERS. That's an online telehealth company. Doctor, good to see you. So what do you make of the FDA review of Mifepristone and the agency that deemed it safe 25 years ago?
Yeah, that's a great question. And as an OBGYN, the FDA is required to review evidence periodically. What I do find concerning is in this review, which was asked, is this really driving concern towards decreasing the limit on access when we think of medication for medical abortions? And even as you said, these drugs have been deemed safe since 2000. So they've even done periodic reviews since then in 2016, 18, all the way through 2021. So when we think of women's health research and access, we don't put a lot of dollars towards that. So for something that has been deemed safe, not only in the US, but globally, it is concerning that we may be limiting women to access for their own health care.
Speaking, just break down for people who are watching the risks involved in the use of this medication.
Yeah, when we think of risk versus benefit, now this medication, again, has been used so much and really has good efficacy. So, efficacy meaning how effective is the drug in doing exactly what it's meant to do. And so, when we think of medical abortions, more than 60% of all these abortions are done with mifepristone and another drug called misoprostol. So when we think now of risk, when someone is looking at the risk that they may have taking this medication, they really are limited and they're low when you think about that. So that may be bleeding, that may be infection, but ultimately, when you look at the benefits outweigh those risks. And that actually was one of the things that was reviewed over the years of what are those risks. And what they found was that the risk with using this medication was so low that this is something that can be deemed safe enough to be given in a telehealth format.
All right. So if the FDA review leads to the removal of the drug, what options are left for women who need a medical abortion? Medication abortion, I should say.
Yeah, absolutely. So we do have that other medication called misoprostol, but what we do know is them used together is more efficacious. So that can be used as another option. And also an IUD, which is an intrauterine device, can be used as well, but it has to be put in at a certain amount of time after, and it has to be done in office. So when you look at access, that really is key for medical abortions. Access is always going to be the number one thing that needs to be improved. So we're decreasing that limitation. And so I think that these are the things that actually need to be discussed, and women need to understand what this means for them when they may need this type of care.
All right. Dr. Jessica Shepard breaking it down for us this morning. Thank you very much, doctor. Appreciate it.